medical device company that simplifies ear, nose, and throat, or ENT procedures. And our first product addresses the 5 million chronic eardrum perforations in the US today. Chronic eardrum perforations come from ear infections, which a lot of kids have, and trauma, and these perforations never heal. It looks like a pretty minor problem, but leaving these perforations untreated lead to recurring infections, hearing loss, and a decreased quality of life. The only option for these patients is a 2-hour surgery where the surgeon partially detaches the ear to access the eardrum and apply a graft. This highly invasive procedure is expensive, it's risky, and it has a long recovery time. Ear, nose, and throat surgeons do not like to do this surgery, and it's because of the complications from the surgery itself and general anesthesia. And that's why we developed the Perfix Otologic Gel Patch. Perfix Otologic Gel Patch replaces that invasive procedure with a very quick clinic visit. It only takes a few minutes to apply and a couple of weeks for the eardrum to heal. Perfix is applied directly to the eardrum through the ear canal, then cured with light to form a scaffold for cells to start growing across that perforation. As the cells grow, they consume Perfix and replace it with new tissue that looks exactly like the original eardrum. We are in clinical studies now. These images are from a 5-year-old subject. The procedure is very well tolerated with no sedation and no anesthesia. Since eardrum repair is inevitable, Perfix is really creating efficiency for the patient, for the surgeon, and the insurer. So compared to the gold standard surgery, Perfix procedure is faster, it's cheaper, it's safer because it doesn't have anesthesia, and it has high success rates. And because the same billing code can be used, whether it's performed in the operating room or in an outpatient clinic, ear, nose, and throat surgeons can use that same billing code for the Perfix procedure as surgery, but they get higher revenue because they're seeing more patients per day. So we've made some significant traction leading up to our clinical study, which is our last milestone before FDA approval as a de novo application. And we're launching Perfix for both adults and kids in the next 12 months. To get here, we've raised over $3 million in private investment and have won over almost $7 million in non-dilutive grant funding. At target market capture, Perfix can generate over $100 million in revenue. This is coming from fewer than 1,000 ENT customers treating over 50,000 patients annually. And this snapshot is just for Perfix. We can iterate on this model for follow-on products within the ear, nose, and throat space. We have a great team in place to execute on our commercial strategy, and we're also supported by incredible and very prominent ear, nose, and throat surgeons and medical device executives who've had very successful exits. We are currently raising a Series A round of $5 million. It's an equity round. This is supporting our commercial launch of Perfix. Funds are going toward expanding our team to support sales and operations. We're scaling up our manufacturing. And all of this is in service of getting to sustainability so that we can position ourselves for a high-value exit within the next 3 years. And also exciting, this is probably the last round of money we're going to raise. You better jump in now. But we're an attractive investment right now because we are basically as de-risked as we're going to get. We are the lone player left standing in the field, which is a huge luxury, and we have acquirers waiting for us. So thank you very much for your attention, and look forward to talking to you out of the booth.